Welcome back. Hope you're having a good time this evening. Next up, we have Dr. Joe Tafur. I had the pleasure of meeting him last year at Psychedelic Science 2013 in Oakland and got to witness him give an amazing presentation on all sorts of interesting things in the brain and love. And I don't know, I just walked out of there feeling fuzzy and yummy, and I'm just excited that he's here with us. He's traveled a long way to be with us. His presentation will be based on his work at the Traditional Healing Center, Nihue Rao Centro Espiritual, where Western patients are treated with traditional shamanic techniques, including ayahuasca ceremony. This is a center in Iquitos, Peru. These techniques appear to be effective in treating a number of psychological and psychosomatic problems. Drawing on clinical experience and modern research, Dr. Tafur theorizes that this healing occurs at deep emotional centers in the brain and in the body. Dr. Joe is a family physician and a magical human being, so let's give him a warm welcome. Thank you.
All right, thank you, everybody. It's a real pleasure to be here. Thank you. Can you guys hear me all right? How's it going so far? Thank you to you guys, CIIS, to ERIE, to Ido, who came to our center. We have some of the Christina that's been to our center, you know. So we have some people that have been through the work that we do. A lot of times my talks are about science, you know, medicine, because that's one of my big things, is trying to convince the medical community that I'm a part of that what we're doing is valuable and can be very helpful to a lot of people. And then sometimes people are like, oh, but, you know, what about the shamanic? He doesn't talk enough shamanic. But, you know, here we have some people that have been in this center. They've been in ceremony with me and with our shamans, and they could tell you, you know, come and check it out. So this talk, to try to be exciting, there's been, my friends are trying to encourage excitement. So it's the usual, integrating the modern practice of traditional ayahuasca shamanism, but also, ta-da, introduction to hyperdimensional navigation, huh? All right. So here we go. You might be disappointed. It might just be a big bluff, you know. So this is my background. I'm a family medicine doctor. I trained at UCSD Medical School, UCLA, family medicine, was involved in integrative medicine for a while. Did some postdoctoral research in psychiatry and psychoneuroimmunology, and then I work as a doctor, primary care, urgent care. I'm licensed in California and Arizona, but I'm doing less and less of that and more shamanism. I'm trained shamanically at Nihue Rao Centro Espiritual, the center. This is our center. It's a traditional healing center in the Amazon rainforest. I'm one of the partners and the founders, along with Ricardo Amaringo, a traditional Shipibo master, and Svita Mamek. We'll get another photo of them. This is a group of students that come from the Southwestern College of Naturopathic Medicine from Arizona, where I'm from. And we had a second group come this year as part of their education and process. You know, they're coming through it for a healing experience to learn. In this medicine, you know, the way to learn the medicine is to go through the healing. That's actually the educational format. So that's them. This is the center. That's the location. So we are in the Amazon rainforest on the edge. Just everything that way is national forest, as far as the eye can see, and then this way is a village, and then make your way into the city of Iquitos. As people have been mentioning, this kind of work is very useful in reconnecting people, and particularly in a setting like this, with nature, you know, with community, with ritual, spirituality, all these things that a lot of people have identified are missing, and it's harmful for us, in fact, to be disconnected from those things, because we are evolved and designed to be part of those realms. So this is another shot of the office. So we're a traditional Amazonian healing center founded in 2011. We practice traditional Shipibo, shamanic, and plant medicine coming from the Shipibo culture of the Ucayali region in Peru. I'll show you a little map. And we do healing through plant medicine. So we offer, it's a spin-off. I think Veronica had been to the Ricardo's Master Center, and we're kind of a spin-off. And we do traditional Shipibo diets, very much in the style of his master, with master plants and other healing plants, and then we do specialize in traditional ayahuasca ceremony, and that's why a lot of people come down. So this is my partners, Ricardo Amaringo, Shipibo Master, Ayahuasquero, and Svita Mamek, who is a up-and-coming healer in her own right and a visionary artist. So we do integration between the cultures in the sense that we're translating this culture to the Western patients. And there's also an art maloka, an opportunity for expression, and occasionally we have some visiting healers. So this is Peru. My family's from Colombia. I'm not Peruvian, but Iquitos is practically Colombia. You know, I think it's very close. It's very close. But you know, Lima, okay, she's from Lima. Machu Picchu, Cusco, you've probably heard about that in the mountains. Lima's on the coast. And then in the northeast, you see Pucallpa in the middle. That's where the Shipibos are from, the culture that I work with. Traditionally, their homeland is there. Up the Ucayali River, you follow the river down, and you get to the Amazon. And there is Iquitos, where the shamans are coming. The Shipibos and other shamans are coming because that's where the tourists are coming. Okay, this whole phenomenon that some people criticize, but there it is. The Amazonian medical tourism, ayahuasca tourism, thousands of travelers are coming every year to the Amazon for healing, learning, and exploration. Those seeking shamanic, is it cut off there? Is there a way to move the? Like just a couple of letters. Oh, okay, very good. That's why I'll read it just so you don't miss it. Those seeking shamanic healing are most often coming for problems which they have not yet found relief. Okay, that might be regarded as psychological, psychiatric, psychosomatic, and if you will, spiritual. So here we go. So just a comment. I'm drawing some slides. So I've given this talk at MAPS. Then I did an extended version that's on YouTube. So I'm just touching on that. You should check out the extended version if you haven't seen it, because I try to explain it. Or the MAPS talker, oh, you're so fast. It's so fast. But they didn't give me much time. So the other one's an hour, and it tries to explain some of the ideas. I'm going to touch on those ideas, but I'm trying to go into a new topic. Since you guys came all this way, you could just watch the other one on YouTube. But you know, this culture, the issue of the culture, you know, the materialist culture that is disconnecting us from nature, community, and spirit, etc. You know, in this United States, you know, which is kind of the lead in this materialist globalization. You know, we have 50% of the world's prescription drugs are consumed here, according to this documentary, American Addict. 80% of the world's prescription narcotics, you know, the OxyContin, etc., Vicodin. So it's pretty unique, you know. It's not all the cultures of the world are suffering this way. It's something that we're doing, you know. We have a cultural problem. So we may need to look beyond our culture to find a solution. You know, that's one of the theories. So us down at the center, you know, we see, and this is what the other talk is about, is this idea of spiritual illness that somebody else that you touched on, you know, and this idea that from the Shipibo perspective, you know, what are these people from our culture suffering from, maybe perhaps in a more prevalent way than what they suffer from. The village, Yanchama, you know, you guys have been to the village where these people are living in nature and community, and they don't have these problems really, you know. And you can say, as a doctor, I can go ahead and tell you, you know, there's not an anxious person in Yanchama that I know. But still, you know, here with this culture the way it is, we see, you know, predominant kind of like increasing rates of these problems. And on top of it, ineffective solutions generally by what's offered, you know, through the insurance-based healthcare system that's been scientifically validated, et cetera, you know, the corporate, what's offered from the corporate side. So, you know, unreconciled emotional, psychological trauma, sexual trauma, anxiety, depression, PTSD, addiction, you know, some degree of, you know, allergy, asthma, you know, this autonomic dysfunction, I call it. Some autoimmune disease is improving, and then, you know, psychosomatic problems. So this chronic fatigue, chronic cough, body pain, you know, fibromyalgia-related issues, immune dysfunction after a disease, they don't get better. So we see people get better using this other cultural approach. So this is what we do with people. This is the treatment protocol for everyone, actually. But they do to get different plants. You know what I mean? In other words, she was treated with ayahuasca for her issue. And so there are different plants and there's different protocols as far as ceremony and ayahuasca are concerned. But the basic diet that people are going to be put on as part of their treatment at our center is you come in, you do a vomitive of plants. Then you review your intentions with the shamans. Why are you here? How can we help you? From that, we're going to decide what kind of plants we're going to use in your treatment. You're assigned a master plant, you know, be it ayahuasca or coca or some of these other plants. You're going to be put on a vegetalista diet that's designed to help you connect with the plants and get the most of the plants. Some people are going to be put in isolation, you know, or they may opt to be in isolation to go deeper within themselves. There might be additional plant treatments, topical treatments, vapor treatments, ritual baths. And then we have the ayahuasca ceremony. So we do ayahuasca ceremony Monday, Tuesday, Thursday, Friday. So we do a lot of ceremony, you know, we're in there a lot. So we have a lot of experience, you know, in dealing with people. And I have a big opportunity there to see a lot of ceremony, participate, and learn about ceremony. Then we do post-ceremony conversation every morning, or 3 out of the 4 we do a conversation to integrate to some degree. And then there's also the opportunity, depending, to talk one-on-one with people who we feel like need more help. That's what we do there, you know, and then that continues. That's their diet. That'll continue for days, that'll continue for weeks, that'll continue for months, and there are people who train for 1 year at our center. That is the training to become a shaman. So just briefly, I mean, maybe we don't need to talk about the entheogenic thing, but just a brief introduction. You know, ayahuasca tea, here they are cooking it, is part of a tradition of traditional Amazonian plant medicine, you know, kind of like traditional Chinese medicine or Ayurvedic medicine. There's a lot of other plants and herbs involved. Ayahuasca is a specialization within that plant medicine tradition, and Ricardo, that he is a specialist in that. So ayahuasca, as you guys may already know, is a vine that I've referred to there as La Madre, Mother Ayahuasca, that's boiled alongside. In our center, there's other ways to prepare it with chacruna leaves, which are the source of this DMT, this hallucinogenic molecule, this psychedelic molecule, this entheogenic molecule that is, you know, getting a lot of attention in part because Rick Strassman, MD from University of New Mexico, did research, was the first research, clinical research to be done with psychedelics since it was shut down in the, I guess, in the early 70s. So he is one of these people saying, wow, you know, there's DMT in your body already, you know, and we don't know what it's doing there. But when you give people a little bit of extra, you know, wow, they have spiritual experiences, you know, very commonly. So he's one of those people who's looking at what is the spiritual machinery that exists within the body for someone without psychedelics, without entheogens, through meditation, through prayer, through walking through San Francisco, to feel, you know, these kind of connections that that many people are experiencing. So then, you know, one of the issues is that a lot of people focus on this DMT that I always speak out against, is that, you know, that's the single molecule, and some people have the idea, kind of in a Western reductionist perspective, that ayahuasca is just a DMT delivery device. You know, it's just with the right plants you can get more DMT. And in fact, it seems like it's different, you know, because it's a whole plant tea. And through that, traditionally, you're able to access like a whole other realm, which is the world of the plant spirits, and through sacred ceremony. And then there's also additional components of the actual ayahuasca vine itself that are more highly regarded for their healing properties than the chacruna, actually. The chacruna is thought to be what brings the visions, you know, but the visions don't heal you. You know, the cleansing, you know, a lot of it happens through the purge, through emotional cleansing, and some of that seems to be guided by the ayahuasca vine itself. So it's the combination that allows us to do maybe perhaps something more than what just drug DMT, you know, because once it gets into that talk, that's where the shamans are offended, because they're like, oh, now the ayahuasca is a drug. It's like, well, ayahuasca is not a drug. We didn't have one drug here. You know, you guys brought the drugs, and now you're telling me what I do, my plant medicine, my patrimony of my culture, is a drug. You know, it's a little confusing imposition. So there is this renaissance of psychedelic medicine research. You know, the MAPS, they had the conference here last year, it's been mentioned, and just to touch on a couple studies, the MDMA-assisted psychotherapy study that's been mentioned, you know, it's a big highlight. Psilocybin for end-of-life anxiety, and then now there's beginning to be clinical research, and there's more, but this is a bigger study that's coming off of this study, is ayahuasca for addiction. So I'm down there, you know, so my role, and that's the old talk mostly. Oh, no, we haven't even got to that. But my position is that I'm interested in understanding the developing role of traditional spiritual medicine in modern society from the perspective of myself, a medical doctor, but also someone who's undergone shamanic training in the Amazon. So I'm looking for that intersection between Amazonian shamanism and allopathic medicine, you know, so that for a lot of reasons. For one reason is so that maybe one day I can practice here, you know, and be able to explain myself to the larger healthcare community, and also to help people access a medicine that I think can be very helpful if done responsibly. So this is just a little vision I had, a little drawing. So in my other talk, you know, I just touch on this this thing. emotional body, that's what I kind of introduced in the last thing, is like this, as a doctor, this idea of the emotional body, these subtle energy bodies, like they just don't come into the conversation, because we have the anatomy and we have the bones and the tissues, and that's it. There are areas, we know they're willing to accept that, yeah, there's emergent faculties, in other words, there's things that the whole system demonstrates that, you can't cut up and find. Somebody's thinking, okay, we accept that they're thinking, which is a metaphysical process, we have to admit. And if you cut up the brain, you're not going to find their thoughts. So it's there, we have it, but then there's a lot of resistance to some of these properties, that maybe our bodies, our minds, our, the idea of the soul and all these things. But at least the emotions are accepted. The emotions are widely accepted in the culture and the scientific community. Even the insurance companies have emotions. But so it's this idea before that was too touchy-feely to talk about this stuff. And so then that was my other talk, was about this idea that I think there is a network already identified that can constitute what is the emotional body. And I would say it's the limbic system, the emotional processing center of the mind. Its connection to the autonomic nervous system, which is connecting, all this automatic activity in your body, your digestion, your sweating, your emotional expression, et cetera, your vomiting, your diarrhea, your immune system, okay, and the endocrine system. These systems are all communicating with each other with similar molecules and compounds, a combination of neurotransmitters and cytokines and hormones that they're all sharing. All of them are producing and sharing. And the compartmentalization that these are different systems is partially arbitrary. We know there's a lot of crossover, and these are all communicating. And, some of the other traditions have been saying for a while, at least, that the endocrine system, they've been trying to relate it to the chakras. So there's this idea that perhaps this is a network that would be similar to what has been described as an emotional body that might have a window into a subtle energy body, and that you could see changes in what would be considered spiritual interventions. You would then see changes in these systems. So the limbic system, is this emotional processing center in the brain that I'm saying is kind of the headquarters of this emotional body. And then of particular importance to this talk is this like hippocampus and amygdala. I'm just bringing those up because those are two little spots that are also considered to be part of the medial temporal lobe, this other part of the brain that I'm going to get into a little bit later. So the limbic system and the autonomics, this emotional center that's handling sensory input so a lot of our sensory input from our senses and also from inside our body are feeding their way in, and they're getting processed through the limbic system, through our emotional system, on their way to our higher thinking, faculties. And so it's handling this input from outside and from within, and then it's managing the way our autonomic nervous system is reacting to that, like the way our digestion is going to react to some anxious feeling about something we're encountering, or sweaty palms, or a smile, or a laugh, all these basic parts of what it is to be human, and integrating this input and output with our emotions. So that's what the system is doing, and their physical expression. So then this limbic energy body, that's what I started calling it in my other talk. I was like, well, now we can just say, why don't we call it the limbic energy body, or something emotional body, something kind of a little more fluffy, to open the discussion. And so that we can try to say that in this network that I talked about might be where some of these emotional traumas are getting held in the body. When a shaman, when we see when somebody feels something here, when they have, with whatever, they have some illness in some part of their body, and then let's say in the ayahuasca visions, you see, oh, there's something right there, and they feel something right there. Or they feel this pressure in their chest, or they feel so many feelings that they have that the doctor is kind of like, doesn't really have a technique to address. But this is kind of like a network that at least we know could be related to all that happening. So emotional traumas, we see sometimes they get frozen in the body, they stagnate, energy stagnate. So then, like we say, past affects the present, something's stuck in there, and then triggers release it, and all of a sudden what was something in the past becomes very present in their experience. And so the idea is that in order to change that, to shift that, yes, there are like spiritual cleansing techniques. There's a lot of different ways to do it. But from the mind side, one of the things that is important is to recontextualize that experience, that trauma. And that's what we just talked about a little bit, was this being able to see it from a different perspective, being able to relive a trauma, go through the experience, but then have a whole new look at it, you know, and that's kind of like reimagining the situation. So the fact is that memory is actually imagination, that a lot of what we remember, we're imagining. Like, you know, they've done so many studies to test people's memories, and they're forgetting everything, you know, eyewitness testimony, and everybody has a different story, and everyone's kind of making it up, you know, based on what they imagine. So then the idea is to eventually get to a point where you can reimagine these things to be blessings, you know, to be a grace in your life, to be something that's going to transform your life, you know, and that's a process that people can go through, that spiritual healing can help them through. So is happening, you know, and this system, I'm talking about limbic system, amygdala, all these limbic things, the pineal gland where the DMT is being produced, the psychoneuroimmunology, the psychoneuroendocrinology, the autonomic nervous system, and then the immune system. And that this is the same kind of like thing where energy blockages and stagnation could be held in the body in that network, you know, in that network, the way it's described in traditional Chinese medicine through acupuncture meridians, you know, in different areas of the body, or through the Hindu metaphysics with the chakras. So I'm saying that, you know, this stuff can be cleared by spiritual and shamanic cleansing, you know, to a degree, but also we need to involve an opening of the mind, you know, and a reimagination and a recontextualization of their experience. So this is the last part from the old talk. I do believe that our treatment works through spiritual phenomena, and also that embodied consciousness does demonstrate manifestations in our physiology. Spiritual illness manifests in our emotional health, and phenomenon like epigenetic imprinting, it's a separate topic in the limbic system, which I theorize respond to strong experiences in the emotional body, ceremony, ritual, spiritual cleansing. So moving on. So there's this thing about mystery, you know, and that's the deal. Like as a doctor, again, you know, where's the mystery? I just told you that thought, as far as I know, is metaphysical, you know, as far as anyone can explain it to me. And we talk about it every day, and imagination is metaphysical, but they act like we don't deal with any mysteries. You know, the mystery is not really on the table, you know, when we're talking about science and medicine and health. But I say that we have to deal with this interface with mystery at some point, you know, and that's what I think a little bit what Veronica was saying, that very limiting, if we can't bring the spirit into it, or we can't bring a whole other level of their internal experience into the discussion, it is very limiting, you know. It is in fact, like some would say, inadequate, you know, as a human being, you know, that I can't tell them this is what I feel, this is what I live, and that is not relevant. You know, that's it feels inadequate, in fact. And so I say, whether or not we conceive of anything beyond this life, we must admit that there are at least two areas of our lives that are still very mysterious and appear to interface with that which exists beyond our understanding. You know, mind, thought, and where is it coming from? Feeling, you know, feeling, even our sense of the world, our senses, and our feeling inside, and our emotions, and all these experiences, that these are still mysterious areas. And then we have the interface between mind and feeling. You know, how our mind is reacting to our feelings, and that relationship, and the way that plays into our health. So we have Yoda again, who's telling us to search your feelings. Yes, that's true, you know, but you need to search your feelings with a clear mind, you know, and so it's the interface between the mind and the feelings, again, that needs to be addressed. So in the spirit of showing your nephew, here's my nephew, Rafi. So we moved on to hyperdimensional navigation, everybody. It wasn't a bluff. We're moving into it. Introduction to Hyperdimensional Navigation, led by my nephew Rafi, who sometimes maybe if you see him walk by, you hear that one song, Happy, but it goes to Rafi, says, 'cause I'm Rafi. That's kind of his world, you know, that's where he operates. So I say, he's like, I think he's almost 4 years old, Rafi. This is an older picture. So his ego is not yet fully formed, you know, he's not really concerned about his ego and self-reflection and those things. He's going through a lot of limbic and emotional development. Like he's more of an emotional process. He's developing his emotional system, and he's learning more about relationships, you know, between people, and which eventually is going to shape how he relates to himself, actually. And you know, then there's this like emotional memory recording, which is interesting in relationship to this trauma stuff in the body, is that it seems like, you know, you use your emotions to remember things too. That's one of their functions. And you can imagine in an animal, you know, that's in the animal body. Yeah, of course. You know, that's how you remember, oh, this is scary, this is good. You know, your emotions kind of imprint the moment, and you start linking that to what's gratifying, what's dangerous for you. So he's in that process, you know, he's very vulnerable, very sensitive. He's taking a lot in, and that's all influencing his development. His family is influencing his emotional development, you know, his idea of relationships, he's getting that from them. And the way he's going to eventually relate to himself, like I said, You know, that maybe it's secondary. First you learn, oh, this is how everyone's relating to each other, and you're going to draw from that to develop your internal dialogue. You know, it seems like that's actually the way you develop. And so then, you know, eventually he's going to get into this, like, once he gets to that point, he's going to be a lot more self-reflective. You know, his ego is going to start developing, and it's going to be about the way his mind relates to his feelings, you know, and that's going to be further influenced by his culture. His culture is going to have a huge influence on the way mind is relating to feelings. You see this guy, the vet they just talked about, you know, they trained him not to feel anything, you know, so now he's going back, and now it's like he's stuck. You know, because maybe he does need to cry for 5 hours about what happened to release some grief, but he can't even access it, you know, so it's stuck. So this will further influence his facility with hyperdimensional navigation in the end, which at least for now is love. You know, I don't know if you guys saw Interstellar. Interstellar, the movie puts it out there that love is in fact a hyperdimensional, you know, thing that you can use to communicate across wormholes. And at least time and space, you know, and I think most people have experienced that to some degree, and maybe wormholes, just in case. So now I'm getting serious, you know. So now the inspiration for this talk, we finally got to it, is this kind of intense paper that was written, and my friend Rael, he's a big neuroscience scholar. And he's like, Joe, you got to read this paper, you know. They talk about the limbic system and all this stuff, all those things you're talking about. And it's this new, very comprehensive kind of integration of these different lines of data of what's happening with psychedelics. You know, at least not everything. It doesn't tell the whole story, but one part of it. What can we say? What have they learned?